I'm concerned about my under eye bags, and sometimes I have puffiness. What procedure do you recommend?
Thank you for your question. You submitted 2 photos, and you're asking in this question about under eye bags and puffiness. So I can certainly assist you with guidance in how to approach this issue. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. And certainly under eye bags has to be one of the most common issues we address in our practice. And we've developed many ways to advance the approach to make it a very productive procedure for our patients in a way that optimizes their recovery. So I'll give you a little bit of understanding as to what is the actual cause for your puffiness. The photo you submitted, you were looking straight up, and that is actually very, very helpful. The reason for that is it actually allows the forward expression or movement of the part of the eye anatomy called orbital fat. And what is showing is that there are fat pockets that have pushed forward, which are responsible for that puffiness. We refer to this as lower eyelid fat prolapse or lower eyelid fat herniation. What it basically means is that the fat that's normally part of the eye anatomy pushes forward and creates these bulges. When these bulges are prominent and constant, they make you look like you have bags under your eyes. And very often people ask you if you're tired, if you've gotten enough sleep, and the other things associated with under eye bags. In a situation like yours, the approach that I would typically recommend is a combination. First would be to address the fat pockets. This would be done through a surgical procedure called a lower eyelid transconjunctival blepharoplasty. What that means is what I do is address the fat pockets from the inside of the eyelids. This way you avoid any external incision or scar. What I'm doing essentially is I'm sculpting the fat. That means reduction, repositioning, sculpting. This way there's no more bulge pushing forward. In addition, what I often do is I combine this procedure with the application of platelet-rich plasma under the skin and in this tissue to help improve the skin and tissue quality. A brief explanation of what platelet-rich plasma is. Basically, what we're doing is we're concentrating the healing and growth factors from your blood and using it to help address some of the changes related to both aging and environmental stressors of the skin around the eyes. This way, we're basically addressing more comprehensively the fat pushing forward and the skin quality so that when you're done, you actually have a more global improvement of this area. It is not unusual when someone has aging changes and as well as environmental or other stressors to the eye area that it takes a combination approach to help maximize and improve the appearance. Now going back to the approach of lower eyelid fat prolapse, what I also do is I do this procedure under local anesthesia with light IV sedation. This means you don't have to go under general anesthesia. Again, an approach that minimizes the stress to your body as well as maximizes your healing potential in a way so that people go back to work faster. Typically, our patients go back to work in less than a week. The procedures we do in our office under local anesthesia and light sedation in our Joint Commission approved facility, which means that we're adhering to standards that of safety and personnel comparable to any hospital. So you get the best of all worlds and you're able to recover quicker. Again, over a 20-year career, this has been an evolution that has optimized the outcomes for our patients. So I recommend that you meet with qualified, experienced cosmetic surgeons who offer comparable options. Learn about what you can have done in a way that is optimal for you, so that you can get the best result aesthetically, as well as the safe in a safe way that allows you a quick recovery. And once you are comfortable with the doctor, once you've seen before and after pictures, and you feel that you have a good connection, move forward. I think it'll make a very nice difference for you. So I hope that was helpful. I wish you the best of luck. Thank you for your question.